In the past hour, the state released some new data showing the ongoing issue of outbreaks at North Carolina's nursing homes. Thanks for joining us. I'm Erica Bryant.
And I'm Scott Wickersham. There are now 83 outbreaks at nursing homes and 36 at residential care facilities around the state for a total of 119, and more than 400 deaths have been tied to people in those facilities. Mecklenburg County leads the state with 18 outbreaks, and that now includes Royal Park of Matthews. They announced today that 37 residents and 7 staff members have tested positive, with more test results still pending.
Have they done enough to keep you safe?
No, not at all.
Channel 9's Mark Becker is live tonight. And Mark, a worker there saying the facility did not do enough to protect everyone, in her opinion.
Yeah, and I actually spoke with a couple of workers here who said exactly that, Scott. The management here at Royal Park, though, says they have done everything they can to try and keep the virus out. 10 days ago, they didn't have any cases. Now they have a major outbreak, and no one perhaps feels it more than the residents and their families.
He's very weak. He's just, sounds like he's very depressed.
Melanie Sprague is worried about her father. The first she heard there was a major outbreak of the virus in his nursing home here was just last week. And on Saturday, she learned that he has it too.
I can't get in to see my dad. My sister can't get in to see my dad. And it's really hard because there's nobody to protect them.
In a statement, the administration here told us today they're doing everything they can to contain the virus. And they detailed just how quickly the outbreak had spiraled out of control. The first 2 staff members, they said, had tested positive on May 16th. The next day, one of their residents was also positive. At that point, they had everyone here tested, and results began coming in on the 22nd. As of today, more than 40 had tested positive, including 37 residents and 7 staffers. Have they done enough to keep you safe?
No, not at all.
This employee, who didn't want to be identified, told us she and others who actually care for the residents here are getting about $1 an hour extra in pay. But it's not enough for the risks they're taking.
It's going to take all of us to fight this. And in order for us to win and come out of it.
Now, management here again says they've done pretty much everything they know to do. They've actually checked employees as they come to work for their temperature. They've also given them goggles, masks, gloves, all of the PPE they would need to stay safe. And still, somehow, Erica, that virus is spreading here, and we may see more cases reported very soon. Erica?
Yeah, Mark, and it's heartbreaking for families that can't connect with their loved ones or see them during this time. And you heard that in their voices. Thank you, Mark. Earlier this month, the state health department gave new guidance on testing, specifically referencing nursing homes. They say everyone who lives at or who has regular contact with high-risk places like nursing homes should have access to testing regardless of symptoms.